So with kidney yin deficiency, the energy is better after rest and at night, and quickly exhausted. Actually, the best I can relate to this because I feel more energized in the evenings. Okay, for kidney yang deficiency, the problems with starting the day, the energy is better at noon and in warm weather. And this is understandable because the yang is very deficient. With kidney yin and yang deficiency, as you can see, it's very chronic. Both yin and yang are depressed. So the patient is always tired, and he would report feeling better at 3 to 7 p.m., which are the maximum time for bladder and kidneys. Now, for the hyperactive yang, very energetic for short periods, very active, but they are better at night. Okay, with stagnation of fluid, so there's a lot of retention, takes a long time to get active. So you will notice that the ankles are swollen because there's fluid retention. So takes a long time to get active. Worse after rest and in wet weather. For urinary bladder hyperactive yang, same as hyperactive kidney yang, because we always consider the yang coupled organ as the yang component of the kidney. Okay, and urinary bladder stagnation of dump is the same as stagnation in the kidney. Okay, so let's talk about the characteristics or the symptoms associated with each pattern. With kidney yin deficiency, small and weak bones, and you will notice that there are easy fractures with dental caries, okay? And menstrual cycles are short, and the patient keeps having miscarriages, short erection, okay? And with regards to skin and urine, it's dryness, little and concentrated urine, and there is osteoporosis, nerve atrophy, general hot pains in the joints. So with kidney yang deficiency, short, slow growing, and lazy. Long menstrual cycles, infertility, amenorrhea, poor erection, increased night urination, generalized cold pain in joints with coldness. So for kidney yin and yang deficiency, short and underdeveloped, irregular cycles, infertility, premature ejaculation, frequent urination, excessive thirst, dryness, osteoporosis, pain in joints all the time. For patients with hyperactive yang, grows very fast and weak, small bones, fractures. So mabilis tumangkad but weak, and they are prone to fractures. Short cycles with excessive bleed, yeah, that's very young. Repeated miscarriages, short erection. Acute kidney colic, acute pyelonephritis. Acute relapse of RA, rheumatoid arthritis, hot pains with feverishness. So for those with stagnation of fluid, they're usually short with large joints and heavy bones. Long cycles with dysmenorrhea before period, cannot get pregnant, poor erection. Chronic impairment of kidney function, there is edema and less urine. Generalized damp pain in joints with edema and stiffness. For urinary bladder hyperactive yang, there is yang pain in the back, weak back, short cycles with dysmenorrhea during bleed, repeated miscarriages, acute cystitis, nervous and frequent little urination, acute backache with sciatica, worse with movement. For urinary bladder stagnation of dump pain in the back, stiff back edema, uterine fibroids, hypertrophy of prostate, long menstrual cycle, endometriosis. Urine retention in the bladder with no urge or poor elimination. Damp pain in the back, worse at the start of movement, pressure pain on sciatic nerve. So for the associated symptoms, we have for kidney yin deficiency, there is tinnitus, selective deafness, otosclerosis. Loss of hair, thin and brittle hair. Active fear. Fear causes physical symptoms of hyperactivity. Kidney yang deficiency, there is nerve deafness, limp and dull hair, and grace early. Phobia, passive fear, can faint or urinate involuntarily. With kidney yin and yang deficiency, chronic deafness with tinnitus, both yin yang deficient symptoms, always in fear of unknown causes. So these are the usual these are usually the people who would seek psychiatric help. Hyperactive yang, acute ear infection, tinnitus, hair loss and thinning, brittle hair. Mostly fearless, in an acute state could be panicky. Stagnation of fluid, blocked ear, Meniere syndrome. Greasy, dull, and limp hair, grace early. Madaling pumuti ang buhok. Okay. Passive even when not feeling fearful. More passive when feeling fearful. Argues why they are right. With urinary bladder hyperactive yang, there is loss of hair on the occiput. Same as kidney hyperactive yang. Okay, kidney yin deficient people, they like deep blue and black, can be therapeutic colors for them. Salty food is beneficial to hold water in the body, but causes hardening of arteries, not suitable in patients with cardiac or blood pressure problems. If yin deficiency is severe, feels cold in the interior, improves after eating or sleep. Kidney yang deficiency, they like sky blue and pastel gray. Crave salty foods, can be consumed when there is no water retention. So you have to really examine your patient. You have to really assess your patients very well. Cold inside and outside. Sometimes they do not feel their feet are cold, but can be icy to touch. Improves with exercise. So for those with both kidney yin and yang deficiency, they like all shades of blue and black. They crave salty foods. They may have edema in the ankles. Salty food can be taken if it does not increase the edema. They feel cold all the time, inside and outside. The feet, however, feel sometimes hot and sometimes cold. So for those with hyperactive yang, they feel calmer in deep blue or at night. So this time you will have, you would know how to advise them with regards to how they would paint their rooms. They dislike salty food. They feel cold inside, especially the bones, and they are hot outside, and there is ascending heat. Stagnation of fluid, grays and deep blues make them feel as if underwater. Dislike. So they dislike these colors. Crave salty food, not to be taken because of the edema. Cold and wet in the lower part of the body. For urinary bladder hyperactive yang, they like deep blue and black. They dislike salt. Backache worsens with activity, bladder inflammation with overwork. For urinary bladder stagnation of dump, they like sky blue and light gray. They crave salt, should be avoided. Backache worsens with rest, and cold bladder infection with exposure to cold. So this table will help with the differentiation of kidney yin and yang. It should not be confused with the table that we have shown earlier, okay, in our past lectures, the differences between the water kidney and the Mingmen kidney. So with kidney yin, think of water, essence, life, past, passive fear, the marrow, bone, nerve, refinement, right brain dominated, endurance, flexible back, soft, lazy, lenient, quantity, and barren. Kidney yang, distribution, elimination, energy, force, future, active fear, sensitivity, function, hearing, left brain dominated, libido, sex, rigid back, hard, active, strong, urination, and fertile.